Hi, welcome to Because Looking Good Feels Good with me, Dr. Janet Allenby and Allie, to my live studio at my house. We're still doing the distancing thing, and we appreciate everybody joining us. Today we are going to be speaking with Dr. John Westine. He's a double board certified plastic surgeon, facial plastic surgeon, and he practices in Delray Beach, Florida, and I've known him for years. And I'm excited for you guys to meet him and get some of his knowledge. And, you know, this series is really about you guys getting some great information on how to understand what we're thinking and at what parameters it is time for you to go beyond the needle or the injection and go for surgery. And he's going to help us today. He's going to be joining us in just a few seconds here. And we are going to hopefully give you guys some information on what to do for the future, because, you know, at some point we do get beyond the filling time. You know, just so you guys all know, I miss you terribly. It is definitely hard not being with you guys. So anyway, I miss you guys, and it's really hard when we are you know, not able to do our normal thing, our normal creative stuff every day. So it's kind of sad, but you know, at least I have Allie, and I do hear a lot of foster people are out there taking care of the doggies, so I do appreciate that too. And I'm getting some messages that they miss you. When are we opening? We don't know when we're going to open. Waiting for an invite. Let me see here. Let's see. I'm going to see if I can get Dr. Westine on there. And
hey, Dr. Allen.
Okay. You and I both are not in the Instagram world too much, so for both of us, it's a little tough getting on these things here. So thanks for joining us.
Thank you, Gigi, for your help. Gigi just helped me get on, so it's good. Well,
so you are.
Thank you for having me.
Oh my gosh! So you're doing a little post-op. It looks like today. You got your.
Yeah. Just post-operative follow-ups with patients and. Little laceration repair follow-ups, things like that are trickling in. People don't want to go to the hospitals. I don't blame them, so they find here.
I know. Yeah. I was beginning to introduce you a little bit. Now, first of all, I think everybody can kind of guess what schools you went to by the hat. You were the University of South Florida. Oh my gosh, he's definitely the Gator guy. Okay, I did it wrong. Okay, he's showing me the proper way here if you aren't watching. Anyway, thanks for joining us. So we're going to talk a little bit today about when is the time to do surgery. And we definitely know I stretch it to the end point of what we can do non-surgically. And, you know, sometimes there becomes a point where I'm just, you know, we're getting frustrated. It's costing too much money. And just real quick, I do want to talk about your education background, because I think people don't realize how much education goes into where you're at today and how you can deliver such an amazing results. And I will tell you, I have a huge fan club of yours in my office. I have the women. I'm not sure if they're just in love with you or, you know, he's got that Southern gentlemanness about him. So, but I know they love the results with you, and you're definitely a very popular name that comes up in my office quite frequently. So first of all, they're probably watching right now just so they get a glimpse of you.
Right back at you. You're loved and adored by my patients as well. So we have you've got your fans up here too.
Well, I appreciate to hear that. So first of all, double board certified. That actually, I mean, you've gone to years of schooling, and on top of it, you have years of experience in the field. So what does that mean? What are you bringing different to the table that, you know, somebody who says, oh, I'm going to be a cosmetic surgeon today, and they were an ER doctor, and not to slam certain people, I'm sure out there are very good, but, you know, that's a lot of education and a lot of experience that you bring to the table.
Correct. Yeah. So the double board certified facial plastic surgeon usually goes through, you know, the general surgery internship, then goes through an otolaryngology head and neck surgery residency, which is focused, you know, on the head and neck, obviously lots of reconstructive work, things like that. And then from there, you go specifically into a facial plastic and reconstructive surgery fellowship. So, and that's a little different than, say, the kind of a general plastic or plastic surgery where you go through general surgery. So you're doing gallbladders and appendectomies, and that's more of a general surgery field. And then from there you go into plastic surgery, which again, then you're doing more of the burns, the body stuff as well. So it's a slightly different path to get here. Obviously, if you're specialized, it's more specifically geared toward facial aesthetics, things like that. But yeah, it's, I think, a 13-year course, 4 years of
I
undergrad.
think we're having a little hiccup here.
What's that? Oh,
Oh, we had a little freeze up there. 13 years is what I think I heard.
yeah, 4 years of undergrad, 4 years of med school, a year of general surgery, 4 years of head and neck surgery, and then another year of facial plastic surgery. So yeah, it's a lot.
It's a lot, but on top of it, you've been practicing for well over a decade, because I've known you at least as long.
Correct. Yes, 15 years. Yeah, I started Delray Beach Plastic Surgery in 2005. So yeah, gosh, time flies.
You know, in a blink of an eye, which, you know, that kind of puts you back to where we're at today. We're sitting at my house. You're not seeing patients, and it does make you reflect on how quick time goes by, and also how important there are to other things. You know, like, I know you have a beautiful wife, Tina, who I've met, and she's fantastic, and children who are just fantastic. And it just makes you really appreciate the simpler things in life sometimes, and sit back and go, wow, what if I lost this? What if I didn't have these people in my life? You know?
Yeah. Oh, no, absolutely.
We are having a little more freeze up here. So it is, you know, I think we're all kind of like attuned to different things. There you go. I'm sorry. You were kind of in and out there. I think we're freezing up a little bit.
Yeah. Well, everybody's at home. They're eating up all the bandwidth.
That's probably what it is. Wait, I think I already ate the refrigerator, so that already went first.
Right. No, definitely during these times, we definitely are reminded, one, how fortunate and blessed we are to have our family and our family's good health, and our friends, to have our practices and friends and family that visit us in our practices. So, through the valleys, we can appreciate the peaks. And right now we're kind of entering this little valley, and so it does make us look back and say, wow, we are fortunate and blessed, and we should be grateful and start every day with that attitude of gratitude. So I agree with you.
Yeah, it definitely makes you think twice. So back to what we were talking about, and I think it's such a fun topic. One of the things, and speaking of which, it's Happy Doctor's Day, by the way. So happy Doctor's Day to you.
Yes, happy Doctor's Day to you, Dr. But yeah, I got a flood of text messages from all the staff, because we're running on a skeleton crew. So there's a lot of at home, and
I know I'm melting. I'm melting here. So one of the big things, and again, I go back to one of the ways I met you is, I think you have a different background than some of the plastic surgeons. And when I met you, I actually met you through one of our Sculptra meetings, which you're one of the few plastic surgeons that really latched onto Sculptra early, like I did. Yeah. And I think you see it differently than some other people, and you are pretty well known for your outcomes and being so natural and nice looking at the end of the day. Do you do filling partially while you're doing your surgery? Let me ask you that real quick.
Yeah, that's a good point. Sometimes, so when I'm looking at a face, most people come in and they say, hey, I like who I am. I want to walk by the mirror and see a reflection of how I've always felt on the inside, because we all have that self-image of ourselves. So my approach is always, obviously, just like you do, to listen. And I think your patients, like mine, are interested in simply being the best version of themselves. And we want that image of ourselves that we have inside of our hearts and our heads to match what we see in the mirror. So to get there, typically we have to understand what's happening during the aging process. So involutional changes, which is why you and I both love Sculptra, because it really addresses that deflation. So that's huge. That's a big part of addressing the aging changes. Then there's also skin textural changes, which is why you have your lasers, Dr. Allenby, and you're resurfacing. You're getting rid of a lot of the dyschromias and things like that, and even texture with the ablative, whether it's this light CO2 or an erbium or even some of the chemical peels. So you've got, so we always think in terms of volume, we think in terms of skin resurfacing. And then your question to me was, hey, when is it time to consider something surgical? And that's where the lifting comes in surgically, because there are certain soft tissue planes that slide, and gravity obviously takes its toll. So when I am addressing something surgically, I always do think in terms of volume as well. a big part of what I do is for volume, it's going to be fat transfer. There are those that say, you know what, I've been working with Dr. Allenby and my volume's pretty good, so I don't really need a big gun like fat to put in 70 cc's of fat or something like that. So for those people, if they're in their late 40s, early 50s, or they've already had a lift and they're looking to do their second one, maybe they just need a little bit of volume. So Sculptra, I actually will use Sculptra in the OR, and that decreases the morbidity of the recovery because you're doing Sculptra with a small, in my case, 25 gauge needle as opposed to a larger cannula for fat, and you don't have the donor site morbidity, bruising, and tenderness, things like that. So yes, I will absolutely use, so if I'm doing a small little lateral lift, trying to get somebody out with their hair down maybe at a week, I will use Sculptra and maybe some HA gels too, like you would do, if they're like, hey, I don't, it's kind of painful to get my lips injected. While I'm out, can you do a little something? So I will do that not infrequently.
Okay, so what I'm hearing, and maybe to help some of the people who may not understand everything we're talking about here, so you definitely think adding some volume, whether it's fat or one of our products in our office, while you're having them out, you're going to add some of that. And then we all know, like within 2 years at least, usually by a year and a half, they're back in my office getting fillers and keeping up with their aesthetic needs, because that just is the way it goes. The day is over where you get one facelift and you're done forever. Those days of you're shaking your head. No, that's not going to happen.
Yeah, no, that's important. You have to dispel that myth. When people come in, they'll say, "Oh gosh, I've been, investing my resources in injectables, and boy, I just want to be done now." I say, well, that's really not how it works. This is, these things are adjuncts, and they're used together for the best outcome. You still need to maintain. You don't buy a beautiful home and then say, bought the home, I'm done. Well, no, you've got to maintain the home. You're going to have to redo some window seals. You're going to have to redo the roof. But it's a maintenance game. Unless we froze you in ice or parallax, you will continue to age. I say the conveyor belt of life continues. I can back the conveyor belt of life however many years.
I'm gonna have to use this.
but the conveyor belt of life continues. So if you and your twin, you're both on the conveyor belt, we're going to set you back so you'll always look better than your twin, but you'll continue to age. And so you've got to go see, Dr. Allenby and get your volume and, resurfacing things like that. So it is a maintenance game. And I think straight at the very first moment that you meet someone, have a consultation, you need to make sure.
No, that's okay.
If I get a pop like that, I'm swiping down. That's what I'm doing. I'm not trying to poke fingers in anybody's eyes. But if anybody knows how to stop those from happening, let me know. I'll
Good luck on that. I don't know any of this stuff. No, but and I appreciate your comments, because I think you're right. It's definitely a collaborative situation at this point forward for people to think that way, instead of just I go to this doctor and that's the one person I'll ever go to, because I do refer out a lot, because it really is we have to use each other's talents, and you can't be great at everything, and you do what you're really good at or really great at, and you send them to somebody else who's really great, such as yourself. So that does make a lot of sense.
Yeah, well, it's a team approach, and that's when people come into the office. We are a team for them. We are here to empower them, to help them achieve their goals so they can look their best, feel their best, and then do their best, whether it's in a social setting, work setting, and countless letters, just like I'm sure you've gotten, where people say, you know what, I got that new job and I was so confident when I went into the interview and I'm just killing it. Thank you so much. I mean, that's why we do what we do, because we want to be part of our patients' journeys. And that's what gets me up out of bed in the morning and, makes me here and enjoy what I do, just like I know you're the same way.
Yeah. I think we all want the best for our people, and because that's what really fulfills us all, otherwise I think this would get tiring after a while, So
no, I had a great story. I was just a long text from my husband. He said, I was unaware, but some of the supermarket chains have special hours for senior citizens to go in, so they can go in first. And So one of my post-op patients, she's now, I don't know, 6 months out or something, she showed up and they said, no, ma'am, this is for seniors. You can't come in. You're gonna have to wait till everybody else. And she said, what are you talking about? So they ID'd her to get into like Publix because she looked young. So I thought I got a kick out of that. But so those stories, yeah, that's what feeds and fuels us, and we want to be part of the journey. So it's kind of fun to hear.
That I love that. I know, I always like it when they ID me, even though I know they just have to ID everybody, because it just, I don't know why, it just kind of makes you go, oh, thank God, even though they're just IDing, then they're IDing my mom right behind me, so it's like, just lost the wow on that one.
No. Yeah, that's right. I've had to buy you alcohol on many occasions when you didn't have your ID because they thought you were too young.
Oh, now we're definitely getting deep here. So let me ask you another question, just for patients who joined us. What's new in your world? Like, is there some different techniques that you're doing, or people are asking for different things than they did maybe like 5 years ago?
I think that yes, there are new technologies. There's no question, but I think the basic desire to still look like yourself, but the best version of yourself, and really, I think most people, what resonates with people is when, I think we mentioned it earlier, when they say, I want to look in the mirror and I want to see me. I just want to see me. And so the techniques to get there, again, it goes back to those same big three things: volume restoration, resurfacing so that your skin looks like it did when you were younger without the brown spots and the red spots, the dyschromias. And then obviously once you get to the point where you can no longer just replace those two and address those two, then you have to go with the surgical lifting. I think some of the radio frequency devices, that's been newer. You had like things like ThermiTite, and it basically uses radio frequency to heat the tissues underlying. You can use it for facial stuff, body stuff, etc. But that's new. And then you've got the Fractura, which uses radio frequency as well. I think the devices are for your 40-somethings, 50-somethings. Once you can physically grab something you don't like, if you say, I don't like this, well, now you've graduated away from devices, and now you're looking at surgery, because really that's what surgery does. No device is going to remove something that you can physically grab. If you don't like this, you don't like this, or if if anything bigger than, like something where you get a lift from Botox, that's where you go with surgery. But it's the devices are great, and there's all kinds of new fun stuff. The cool tone is fun. You've got lots of those devices with your bod squat.
I do.
Actually, everybody's going to need to do that. They're cooped up in their house. So you got to go to the bod squat and get cool tone. Yeah, no, we love it. We just got it as well, so we're following your footsteps, and it's.
So are you on it more than anybody else?
Am I on it right now? No.
I haven't been using it. I'm sure I use it more than any patient that I have.
Well, you were one of the first sites, beta sites. You have more experience than we do, but I did use it at one of the conferences down in Miami a while back, and it was an interesting experience, definitely. But I think that's probably the newest, most exciting technology, using the magnetic resonance to contract and exercise muscles. So that's pretty cool. But there's all kinds of great stuff. So we definitely like that. The radio frequency devices are good. I still like, for minimally invasive, the Ultherapy devices, where you have the focused convergent ultrasound beams to create the little burns under the skin to get some contracting. But again, that's going to be your 40-somethings, your 50-somethings, or somebody that's already done a lift and is in a surgical intervention is trying to maintain.
Right.
And all these things, by the way, it's not the technology in of itself. It's not the tool, but it's the person wielding the tool. So you go to a Dr. Allenby that has countless years of experience. And by the way, going back to you're talking about the education of what it takes to become a double board certified facial plastic surgeon. That's not as important as what you do in your daily practice. So if you go to somebody and they have all these credentials, they can have exactly your credentials, exactly my credentials. But if that's not what they do on a day-to-day basis, that's probably not the person best suited to treat you. or the ideal candidate that you'd select to do your treatments. You want to go to somebody that does it day in, day out. So whatever the tool is, it must be wielded in the hand of someone that is very proficient with that tool.
You know, that's why I do this. It's really to help people understand why they need to do something, how and who, because those are the important pieces to this. And I think you nailed it. And I don't want to take up too much of your time. I know you got stuff to do, and I'm sure you got stuff with your family, or maybe you don't, because we're all like kind of doing nothing.
They kick me out of the house. I keep spraying them. I have this alcohol bottle, so they're like, keep sterilizing us.
So one of the questions we ask when we're closing up here is, what makes you happy and healthy? And, you know, other than just coronavirus time, like what makes you happy on a day-to-day basis?
Well, I think having, you know, a structured routine. We had mentioned that, you know, having that attitude of gratitude. So the second that I wake up and I open my eyes, I'm like, well, you know, grateful. Thank you, God, that I'm here and alive. And then you just go through your thank yous of what you're grateful for. And, you know, friends, family, your practice, your patients, the gifts that you've been given, and for allowing us to share those with our friends, and allowing them to share their gifts with us. So you go through all your thank yous, and then you ask, you know, if you've got a friend in need, somebody that's sick or somebody that's going through a rough time. So that helps to kind of ground me. It's the first thing I do. And then, you know, it's mind body, right? So you got exercise too. So after I do my little morning prayers, if you will, then I go and I do my my routine. I was a competitive swimmer back when I was in high school. So the same dry land exercises that I did when I was a kid, it's just ingrained in my DNA. And so I get on the floor, I start doing my sit-ups and, you know, push-ups, things like that. And then, you know, I have a little gym in the house too, so I'll do that. But I think that helps me to be grounded. And then that's done within like 30 minutes. And then you don't have to think about that anymore. And you're excited and you're happy and you want to go help people. So, and then, like we said, that is the most rewarding thing, being part of their journey and helping them achieve their goals and getting those comments back. I mean, that's more addicting than any narcotic. I mean, it probably releases endorphins for us. So
Absolutely.
But I love that. And interacting with colleagues, you know, talking to you, getting excited, sharing that passion.
Mm-hmm.
We do this for a reason, because it makes us feel good. We want to be part of those patients' lives. We want them to feel good. We want them to be happy. Our profession is very different. It's not an antagonistic one. Like, I've got lots of wonderful sisters that are attorneys, but they have this antagonistic view of life. Like, it's always an argument. But we're here to facilitate and to help. So right. That makes me feel good. And that, and playing tennis when I can. Been playing a lot more tennis lately because but so yeah, I think that's the key for me. You know, wake up, have the attitude for gratitude, say your, you know, prayers or meditation, whatever you want to do. Get your physical exercise out of the way early, and then begin that journey to help your kids, your family, your patients, which is an extension of our family, really, and interact with your colleagues. Be open-minded. Every single person you interact with has a pearl of wisdom to share with you, and keep your heart and your mind open to that, and people can also teach you what not to do. But you always can learn something from each and every person. So I don't know. That's how I'd stay happy.
Oh, I love it. You know, actually, there was a piece on 60 Minutes last night, and Brene Brown. I don't know if you ever listen or read books on. It's called Power of Vulnerability, which that's kind of basically what she talks about, and she's like fantastic. I think she's like the most hit on podcast for TED Talks, which is really, it's what you're saying, and it's an empowerment to be open-minded and to be grateful and to give back. I think that's kind of what I hear from you is, you know, and I think it comes across in the patients who know you. That's kind of what I get from them. You know, everybody who's ever met you loves you, and because you're just a kind-hearted person. And I think that it always comes across in your work too, because I think that it reflects how we practice is kind of how we are also.
Yeah, no, I agree. Well, that's why you've been so, you know, successful and revered, and we have the mutual admiration societies in our offices, so it's nice. But yeah, whatever we're doing, you know, I think it's our patients respond to that, and they gravitate towards that positive energy.
I agree. Thanks for joining us. I'm going to go through some promotions that we're doing through the office, so I don't want to waste your time, but thank you so much for joining us. Bye-bye.
Kisses. Thank you, guys. Take care.
Bye. Anyway, thanks for joining us. Promotions that we're still having, and a lot of people have really actually taken advantage of our gift cards, which are, we have you buy $200, you get a $300 value for our gift cards, and you can get them through our website. We have a $500 gift card where you get a free cool tone, and this is what Dr. Westine was talking about, was our cool tone machine, which, you know, we've been doing body squat, and we've been doing cool tone or muscle stimulation for more than 2 years, and it is a great, I don't want to say the word cheap, but one way to get quicker back into shape. And, you know, I am seeing a little bit of falling apart here since I haven't been in the office. So I have to get back on my cool tone too. Other things that are going on, Christina Monaco, who's our physician's assistant, she's going to have coffee with Christina tomorrow at 10:30, which is Tuesday. And she'll be doing Tuesday and Thursdays, just a quick chat with products and things that are going on in the office. We are going to post our healthcare providers who have been doing such a fantastic job in taking care of the sick people out there. We really appreciate you guys. And we're going to post the people that have won some free SkinCeutical restorative masks. So we'll be sending them out to you. And I think that's all I'm talking about, and I miss you guys, and I can't wait to see you guys. I don't know when we're going to be back open, but it can't be soon enough for me. I'm kind of tired of shredding and cleaning and need to get back to the real life. So see you guys later.